Most men who experience difficulty with sexual performance assume the problem is mechanical, blood flow, hormones, circulation, and those things genuinely matter. But there is an entire system involved that almost nobody talks about. And for a significant number of men, it is the actual root of the problem: the nervous system. Here is something that surprises most of my patients when I explain it. An erection is not primarily a blood flow event that the nervous system happens to assist. It is a nervous system event that produces a blood flow result. The nerves come first. The blood follows the nerve signal. And if the nervous system is in the wrong state, no amount of healthy blood flow will produce the result because the signal to start the process never gets sent. Today, I want to explain how this actually works. The specific nerve involved. Why stress and anxiety physically block erections at the nervous system level, not just psychologically, and the evidence-based techniques that shift your nervous system into the state where normal function becomes possible again. My name is Dr. Elizabeth Kavaler. I am a board-certified urologist and urogynecologist with over 20 years in clinical practice. Erectile function, pelvic nerve health, and the nervous system's role in sexual response are central to what I treat. And the nervous system component is the part that men almost never have explained to them. So let me do that today. Let me start with the wiring, because once you understand the nerve involved, everything else makes sense. The primary nerve responsible for genital sensation and a major part of sexual function is the pudendal nerve. It originates from the lower part of the spinal cord, specifically the sacral nerve roots, S2, S3, and S4. It travels through the pelvis and branches out to supply sensation and motor function to the genitals, the perineum, and the pelvic floor muscles. The pudendal nerve is the messenger that carries sensory information from the genitals up to the brain and carries motor signals back down to the pelvic floor muscles. It is involved in sensation, in the muscular contractions of orgasm, and in the reflex pathways that contribute to erection. When the pudendal nerve is functioning well and the surrounding nervous system is in the right state, the signaling pathway works smoothly. But the pudendal nerve does not act alone. It operates within a larger system, the autonomic nervous system, and that larger system is where most performance problems actually originate. Your autonomic nervous system, the part that runs automatically without conscious control, operates in two opposing modes. The first is the parasympathetic state. This is often called rest and digest. It is the state your body is in when you feel safe, calm, and relaxed. In this state, blood vessels dilate, digestion proceeds, heart rate slows, and the body directs resources toward maintenance and recovery. The second is the sympathetic state. This is fight or flight. It is the state your body enters under stress, threat, or anxiety. In this state, adrenaline is released, heart rate increases, blood is redirected away from non-essential functions toward the large muscles, and the body prepares for emergency action. Here is the critical fact that changes everything. An erection is a parasympathetic function. It physiologically requires the rest and digest state. The nerve signal that initiates an erection, the release of nitric oxide that dilates the blood vessels of the erectile tissue, happens only when the parasympathetic system is in control, and the sympathetic state actively blocks it. When adrenaline is present, when the body is in fight or flight, the blood vessels of the erectile tissue constrict rather than dilate. This is not psychological, it is direct physiology. Adrenaline is a vasoconstrictor. It narrows blood vessels. An erection requires vasodilation, widening. The two states are mutually exclusive at the level of the blood vessel. This is why a man can have perfectly healthy circulation, normal hormones, and no mechanical problem whatsoever, and still be unable to achieve an erection when he is anxious. The anxiety has put his nervous system into the one state where erection is physically impossible. Once you understand the two nervous system states, the cycle that traps so many men becomes painfully clear. A man has one experience of difficulty, for any reason, including simple tiredness or having had a few drinks. The next time, he remembers it, and he feels anxious about whether it will happen again. That anxiety activates his sympathetic nervous system. The sympathetic state releases adrenaline. Adrenaline constricts the blood vessels and blocks the erection. The very thing he feared happens. not because of a physical problem, but because his fear created the physiological state that prevents erection. Now, the next time, his anxiety is even greater, because now he has two experiences to worry about. The sympathetic activation is stronger, the block is more complete, and the cycle reinforces itself. This is performance anxiety, and it is one of the most common causes of erectile difficulty in men who have no underlying vascular or hormonal problem at all. The cruel irony is that the harder a man tries to force an erection through willpower, the more he activates the sympathetic system, and the more impossible it becomes. You cannot will yourself into a parasympathetic state. Effort is a sympathetic activity. The solution is not to try harder. It is to learn to shift the nervous system deliberately into the parasympathetic state where the body's natural response can occur on its own. Here are the evidence-based techniques that shift the nervous system out of fight or flight and into the relaxed state where natural function becomes possible. The first and most powerful is slow diaphragmatic breathing. The vagus nerve, the main nerve of the parasympathetic system, is directly stimulated by slow, deep exhalation. When you breathe in for 4 seconds and out slowly for 6 to 8 seconds, you are mechanically activating the parasympathetic system through vagal stimulation. A few minutes of this slow breathing measurably lowers heart rate, reduces circulating adrenaline, and shifts the autonomic balance toward the parasympathetic state. This is not relaxation as a vague concept. It is direct physiological control of the nervous system through breathing. The second is removing the demand for performance. The parasympathetic state is a state of safety. When sexual activity is framed as a test that must be passed, the brain registers threat, and the sympathetic system activates. Shifting the focus away from achieving a specific outcome and toward sensation, connection, and presence reduces the threat signal. Many couples find that explicitly removing the expectation of erection or intercourse for a period, focusing only on touch and closeness without that goal, breaks the anxiety cycle by removing the trigger for sympathetic activation. The third is addressing the broader stress load. A nervous system that is chronically in sympathetic activation from work stress, poor sleep, or ongoing anxiety has a higher baseline of adrenaline and a lower threshold for tipping into fight or flight. Regular exercise, adequate sleep, and genuine stress reduction lower this baseline, making the parasympathetic state easier to access in intimate moments. I want to be clear and honest about something, because overstating the nervous system role would be misleading. Not all erectile difficulty is nervous system based. Vascular disease, diabetes, hormonal deficiency, and the side effects of certain medications are real, common physical causes that breathing techniques will not fix. The nervous system explanation applies most strongly to men who can achieve erections in some situations, for example, on waking or alone, but not in others, particularly when anxiety is present. That pattern strongly suggests a nervous system component rather than a purely physical one. If you cannot achieve an erection in any situation, including the natural ones that occur during sleep, that pattern points toward a physical cause that warrants medical evaluation. A urologist can distinguish between these patterns and identify whether the root is vascular, hormonal, neurological, or related to anxiety and the nervous system. Often it is a combination, and addressing both the physical and the nervous system components together produces the best outcome. The point of this video is not that performance issues are all in your head, it is that the nervous system is a real, physical, often overlooked piece of the puzzle. And for many men, it is the piece that has never been explained. Sexual function is not purely mechanical. It is the result of a nervous system in the right state producing a blood flow response. Understanding that the parasympathetic state, calm, safe, relaxed, is a physical requirement for erection changes how you approach the whole issue. You cannot force it through effort, because effort is the wrong nervous system state. You access it through calm, through breathing, through removing the pressure of performance, and through reducing the stress load your nervous system carries. For many men, this single piece of understanding, that the harder you try, the more you block yourself, is genuinely freeing. And if the pattern suggests a physical cause, see a urologist. The right evaluation gives you the right answer. I am Dr. Elizabeth Kavaler. I will see you in the next video.